In this video, we will cover Glasgow Coma Scale. Glasgow Coma Scale is a quick, practical and standard system is used to assess a patient's level of consciousness. Level of consciousness is how alert and responsive a patient is to their environment and stimuli around them. The Glasgow Coma Scale is a very helpful tool for evaluating a patient who has experienced a traumatic brain injury or other conditions where brain function or consciousness is altered. To assess the Glasgow Coma Scale, a baseline score should be obtained, and then it should be reassessed often through the nursing shift per the facility's protocol to assess if the patient is improving, staying the same, or deteriorating. It's important to note that assessing a patient's level of consciousness is very important because any changes in it could indicate something serious is happening to the patient and it needs to be investigated. The Glasgow Coma Scale assesses 3 responses by the patient to a type of stimuli. These 3 responses are eye-opening response, verbal response, and motor response. Stimuli used during the assessment can range from verbal or audible stimuli to painful or pressure stimuli. There are 2 types of painful or pressure stimuli that can be used to achieve a response in a patient. These types include central and peripheral stimuli. In central stimuli, pressure or pain is applied to the center of the body to create pain. This tests the brain's response to it. First is the trapezius squeeze. Use the index finger and thumb and squeeze 1.5 to 2 inches of this trapezius muscle. Start with slight pressure and then increase the pressure for up to 10 seconds. Note the patient's motor response. If there is no response to trapezius squeeze, we have to move to the supraorbital pressure. Find the notch under the inner part of the eyebrow. Apply pressure to this notch with the thumb and gradually increase pressure for up to 10 seconds. Note the patient's motor movement. Sternal rub is no longer recommended because it can cause bruising. Peripheral stimuli. Pressure or pain is applied to a peripheral extremity like the fingernail bud to create pain. This tests the spinal cord response to pain. Next, we will see the Glasgow Coma Scale scoring. Glasgow Coma Scale score can range from 3 to 15. As pointed out above, this scale is useful with patients who is sustained a head or brain injury. The score can be used to describe the injury. 3 to 8 is severe brain injury, 9 to 12 is moderate brain injury, 13 to 15 is mild brain injury. A Glasgow Coma Scale is never higher than 15 or never lower than 3. The higher the score, the better for the patient. Glasgow Coma Scale 15 is fully alert and the patient will be awake. Glasgow Coma Scale 8 or less, the patient is in a coma and requires intubation due to inability of airway reflexes that protect us from aspiration to work. Glasgow Coma Scale 3, lowest score possible and very high death rate. Patient will be having a deep coma and severe brain injury. Each response category of the Glasgow Coma Scale has its own points, which are added up to give the total Glasgow Coma Scale. A total Glasgow Coma score is obtained from adding up all the responses. Now the overall score is important, but so are the subscores also. The subscores are the scores from each of the 3 responses. For example, you may see a Glasgow Coma Scale score reported like GCS 7 in bracket E2, V2, M3. GCS 7 is the total score, while E2, V2, M3 are the subscores that describes each patient response category of the scale. Before conducting the assessment, see what the patient's baseline scores were and if they have anything that would affect their responses to stimuli or make testing a specific response category more difficult. Example of this would include that the patient is sedated, hard of hearing, mental deficits, paralyzed, intubated, injury to bones, swelling, etc. If such patients, it is difficult for us to assess the Glasgow Coma Scale. Intubation affects verbal response. For example, let's say the patient is intubated. It will be hard to get a verbal response out of the patient because they have a tube in their throat. So you can't test this response category. Therefore, this part would be labeled NT, that is for not testable. We should not give them 1 point, no response, because we cannot test it and don't know if they could respond verbally if they could. So the Glasgow Coma Scale may look like this: GCS 7T, E3, VT, M4. This tells us the overall score is 7, but the patient is intubated. Capital T tells us this. To help remember what to assess and how to score it while you are at the bedside, remember EVM 456, eye opening response. Patient can receive a maximum of 4 points and a minimum of 1 in this part of the scale rating. Therefore, the patient can be assigned either 1, 2, 3, 4 or NT, not testable. 4 points. Eyes spontaneously open. Walk to the bedside and just look at the patient. Are the eyes open? 3 points. Eyes open to sound. Speak in a tone that is loud and clear to be heard. Not if the patient has hearing difficulties before attempting or injuries that can prevent hearing clearly. 2 points. Eyes open to pressure applied to nail bed. Use an object like a pen light or pen to gradually increase pressure on the nail bed for up to 10 seconds. We have to note eye-opening response. 1 point is no response to any of the above stimuli. NT, for example, eye swelling or an injury that prevents the eye from opening. Next is verbal response. Patient can receive a maximum of 5 points and minimum of 1 point or not testable. Therefore, the patient can be assigned either 1, 2, 3, 4 and 5 or not testable. 5 points. The patient will be oriented. Ask a series of questions like, can you state your name, month and year? Where are you at? 4 points. The patient will be confused and says the questions but with incorrect answers. For example, they are in the hospital but they say at home, or they give an incorrect year or name. 3 points. Patient will give inappropriate words, says random words that don't make sense to the questions. 2 points. The patient may make only sounds but no words to the questions. 1 point means no response. NT. For example, the patient is intubated. That means not tested. Next is motor response. Patient can receive a maximum of 6 points or a minimum of 1 point or not testable. Therefore, the patient can be assigned either 1, 2, 3, 4, 5 and 6 or not testable. 6 points. The patient may obey a motor command. Tell patient to do something that requires 2 steps. For example, open your mouth and stick out your tongue, or lift your hands and squeeze my fingers and let go. If the patient doesn't obey verbal stimulus to perform a motor command, use a central pressure stimuli by using the trapezius muscle squeeze. If no response, use supraorbital pressure. 5th point. Localize the pressure or pain. The brain will try to locate and remove the painful stimuli. When stimuli is applied, for example, trapezius squeeze, the patient bends the elbow, that means elbow flexion, and moves arm and hand up above the collarbone, trying to remove the pain or pressure. With this movement, the patient is trying to locate or hence localizes the pressure or pain. 4 points. Withdrawal symptom. The patient will have withdrawal symptom, or also called normal flexion. The brain will try to withdraw from the painful stimulus. When stimuli is applied, for example, trapezius cues, the patient flexes, hence bends the elbow flexion, but quickly withdraws it. The hand and arm never make it up to the stimuli or up to the collarbone, so the patient doesn't locate the pain but withdraws from it. 3 points. Abnormal flexion or decorticate posturing will be seen in the patient. When stimuli is applied, for example, trapezius cues, the patient flexes, hence bends the elbow gradually and moves the arm to the center of the body with pronation of the forearm and flexion of the wrist, and the hands will turn into fist. There won't be the withdrawal from the stimuli like in the previous response. This is not a good finding and means the cortex is affected. 2 points. Patient will have extension, that is decerebrate posturing. When stimuli is applied, for example, trapezius cues, the patient will extend the arm at the elbow with internal rotation of the arm. This is the worst type of posturing and is not a good sign. It indicates the brainstem is affected. Next is 1 point, that means no response. If the patient is on sedation and paralyzed, we cannot test the patient. That means we have to write NT, not tested. This is all about Glasgow Coma Scale and assessment.